Hi, everybody. Welcome to the first episode of The Blunt Therapist. You might be asking yourself, the blunt therapist, what is a blunt therapist for? Well, the blunt therapist, this is a place where we get to speak bluntly, where I get to talk to you about what's going on in therapy and to have a very, very, very frank conversation about what might be going on in the therapist's mind, what clients might need, what you might need to give you the information to help guide you to helping you get the best therapy that you possibly can. So within this blunt therapist, I would like to really highlight that blunt does not mean rude. I have no intentions of being harsh, mean, or rude. I have rules, and my rules follow thus. When we exchange information with other human beings, we all expect something that is supposed to be there, and we're kind of off the mark in it being there. We are expecting people to be present with us. We are expecting people to be tolerant with us. We expect people to be patient with us. We expect people to give us dignity. We all expect this. The hard part is we don't know how to do this often. Our own feelings get in the way. Our own experiences get in the way. Our own things called projections get in the way. And I will explain those as the weeks go on. But as we expect this treatment for others, it's really hard for us to do this. And so within the blunt therapist, my goal is to try and give you as much information as we can and be able to learn how to provide presence, patience, tolerance, dignity, and compassion, all while having frank conversations that your therapist might not be able to have with you or might not have the time to answer. So for example, in the coming up weeks, we're going to talk about the history of psychodynamic and psychoanalysis. Understanding the history of psychoanalysis opens up so much information as to why it is so challenging to get really good treatment for child sexual abuse. There's a very, very strong correlation and connection between the history of psychoanalysis and the history of how we talk about and deal with and treat child sexual abuse in therapeutic settings. It also is going to intersect into the history of medicine, the history of this theory that the mental illness is the result of a genetic predisposition. I'm going to underline the fact that this is a theory and that there's other theories out there as well. And I'd like to share and give some of those other theories their much needed and required platform. So in the next couple of weeks, I plan on speaking about the history of psychoanalysis, the history of therapy, giving a conversation of how a social worker is trained differently than a psychologist, which is trained differently than a psychiatrist, and then there's a group of other types of training that vary a little differently, and I'd like to explain some of those so that you are informed when you go and sit down. My belief is therapy is a sacred exchange between two humans. And hopefully that one human has enough training, enough education, and enough of their own personal work done that they can guide you through these challenging times that must be there in order for you to be in therapy. There's also a political role that the insurance companies, that medicine, or that policymakers have spread. And some of those policies are based on information that's not necessarily the best for people when they're looking for therapy. Therapy is an investment. Therapy, in many ways, is almost a responsibility. I think responsibility is a bit of a loaded word. What I mean by responsibility is that the fact that we end up in therapy is not our fault. There are too many things going on in the world that it's really hard not to be mentally ill in the society that we have created for ourselves. And so when you go into therapy, there's this very intimate exchange between therapist and client. And what I mean by responsibility, there is things that people don't see unless you finish and complete a therapeutic process to the end. Things like reward, things like self satisfaction, things like internal pride that make us feel better in this world. There are things that we need and things that we don't need, and not all of the things that make us go to therapy is because of a genetic problem. And I'll explain that as we go along and throughout these journeys together. So for our first session today, I would just like to give a little bit of information on why I've decided to do this in order to see if this can help you. One of the reasons why I've decided to do this is because I'd like to have a bigger platform and be able to communicate with people things that are important to know in a therapeutic setting, things that aren't commonly talked about, things that there's sort of assumptions, and these assumptions actually aren't truth. For example, the assumption that therapists have their shit together. And this is where I'm the blunt therapist. No, a lot of therapists do not have their shit together. It is not required to do any self-work for most graduate programs. So the graduate programs, the people who are going to be treating as you're going to have your people who get their degrees in simply counseling, their postgraduate. So in order to do long-term therapy or to do any type of therapy, you have to have a master's degree or more. When we're talking about the healing profession, you've got your coaches, you've got your people with your diplomas, you got your people with your bachelors, and you got your people with your masters, and then you got your people with your PhDs and your MDs. The people with the coaches, these are people who have taken 6 or 8 week courses where they are asked very superficial information. It might be very helpful if what you're needing is a little bit of motivation or a little bit of encouragement. That's the role for coaches. It's very surfacey. It's not terribly crisisy. It's certainly not trauma. Then you have your bachelors. These are people who are usually in the front lines. These are people who are usually working in agencies. These are people who you can have your bachelor's in social work, your bachelor's in sociology, your bachelor's in psychology. Most of these people are working in frontline centers like sexual assault centers, domestic violence centers, centers for homeless, centers for addictions, that kind of stuff. These are more supportive roles. There's a little bit more nuancing. They can handle a little bit more trauma and a little bit more trauma therapy. Social workers are the only ones who are really required to do a practicum in your social work for your diploma or degree, you will one semester will for sure be doing frontline work with the people in the one-on-one work. So when I mean practicum, that's a term up in Canada. Another word for it is internship. These are mostly from Canada. It could be a little different in other countries, but in Canada, our psychologists are not required to have a practicum or an internship to get their degree. They are often required to do volunteering. They're often required to have some sort of role or some sort of position in the community actually working with people. But the practicum part of it is usually just the social workers. Same with their diplomas as well. There's a lot of diplomas that are working with youth and children that involved practicums, and there's a lot of degrees in working with people who have mental challenges or mental disabilities or physical disabilities. So people who are taking their diploma in working with special needs, those people would likely get a practicum as well. So when we deal with psychology and the upper types of therapy, you're not going to have, if people have a master's or beyond, then you know for sure that those people have had practicums and supervision. So what involves in that internship and that practicum is that they go in, they do the job, they work with people, and they get supervised, and their training is supported by other people. When people graduate with their master's in the area of social work, in the area of psychology, in the area of counseling, they then have to do further training. They have to keep track of their hours, that they're still working with people, and those hours are supervised. And it's after a certain amount of hours that you can get your license. So everybody who graduates will have their master's in social work or their master's in psychology or their master's in sociology. Sociology still doesn't require a practicum, but psychology and social work do. Then to go on, especially in counseling organizations, like if you get your master's in counseling, you will also have a practicum in supervision. Then you have to go on to further licensing. So when it comes to who is best and who is better. There is no who is best is who is better when it comes to master's level psychology, master's level social work, master's level counselors. And that includes marriage and family therapists as well. They are a little different. They focus on a little different areas. For example, psychology is just about the individual and social work is about the individual in the environment. So with social work, there's a little bit more self assessment, self-analysis that has to go along with the degree. Oftentimes you're writing journals. Counseling, Masters of Counseling, it does follow the same thing. There's a lot of check-ins. Psychology is a little less with that. But in no uncertain terms, in any of these things are you required to do long-term therapy. So for the graduate of the Masters of Psychology, or the Masters of Social Work, Masters of Psychology, there is not one class that says you need to do long-term work with another therapist. It can be recommended or suggested, but it is not required to get your degree. Then we take a look at MDs. MDs get their 4 years undergraduate degree. So that's a bachelor's degree in whatever, could be just sciences. And then they get their MD. And while they're getting their MD, their doctor degree to be just a family doc or a general doc, they take rotations, and they may only get a 6-week rotation or an 8-week rotation in the mental health ward or in psychiatry. So when it comes to an MD, actually someone with a diploma might have more training and education when it comes to mental health problems than an MD does. So if an MD is giving you medicine and you're unsure about that medicine, you have every right to ask that question of what kind of training that they have in order to be able to give this medicine or to make these assessments of your mental health. A lot of times docs do not take the same amount of training that psychiatrists or psychologists or even social workers take when it comes to assessment and trying to figure out what's going on with that person in order to give them the best treatment that is available, because different problems require different treatments and different problems show up in different ways. And sometimes docs aren't really taught that. Psychiatrists also then go on for another 6 years after they've graduated from their medical degree to get their degree, or to get their to become a psychiatrist. It's one of the longest specialty trainings that there is out there for docs, and even then they're not required to do work on themselves. They are learning more about medication and the biological connections of the medication and that kind of stuff, but they are not required to do their own personal work. So there's not a lot of places that really require people to do in-depth personal work. What does this translate to? It translates to, unless your therapist has gone out and done their own stuff, it doesn't necessarily mean that you're going to have a therapist that understands their own stuff. I have had many people tell me, but you're a social worker, you should have your shit together. No. And a lot of times, at the beginning of my career, I did not have my shit together. It took a long time for me and a lot of therapy and personally to get my shit together. And so when you're working with your therapist, it's not because this is your money, because this is what an investment in yourself. You have the right to ask your therapist what is their own personal training and how much stuff that they have done. Therapists who've done their own work become amazing therapists because they know what it's like, but they also have learned to understand their own selves in many, many ways. And it's really super important that the therapist has done their own work in order to serve you best. Please leave comments. Please like and click and subscribe, that kind of thing. I will be back next week to talk about the history of psychoanalysis and how that history of psychoanalysis affects us today. Thank you.